We all have various health challenges that arise from time to time. Sometimes it's related to our diet. Sometimes we need to see our family physician or our family chiropractor. We're going to learn a little bit more about chiropractic treatments today with Dr. Aaron Bridge of Bridge Chiropractic here in Lethbridge. Welcome to Bridge City News.
Thanks for having me.
Now, can you explain to our viewers which areas of health chiropractors are really able to help us with?
Sure. There's really a broad spectrum of conditions, but as you can probably guess, we're kind of known as back doctors. So we do spend a lot of time working with people who suffer with back pain. Neck pain is a close second. People don't often think about headaches, but we do offer a safe alternative to drugs in terms of how to get some relief from the headaches. And there's a variety of other conditions too: shoulder issues, knees, ankles, and really just general wellness as well. People don't often equate the two initially, but when you're feeling better and moving better, you tend to feel a lot better, and so there's lots of far-reaching health effects as well.
What's interesting as well, when I talk to some of my friends who have irritable bowel syndrome, when they go see their chiropractor, get properly aligned, hey, they feel better.
Well, there you go.
The food is moving better, and they just feel better overall health and better digestive tract.
Yeah, I always tell my patients when the spine is functioning as well as it can be, it gives everything else the chance to work like it should be working too. So there you go.
So what kind of training and what kind of schooling do a lot of chiropractors go through?
It's a minimum of 7 years of education.
Wow.
So that's 3 years of university and then 4 years in chiropractic school. And of the 4 years in chiropractic school, at least 2 of those years we're working with patients under the direction of a practicing chiropractor. So 2 years of hands-on incorporated with the bookwork.
I was involved in a very serious car accident about 6-7 years ago, head-on collision where my Honda Accord was hit head-on by a Montana minivan. By the grace of God, I survived. Wow. But I have to say that the chiropractic treatments really helped in my recovery. How often do you work with patients who were involved in serious car accidents?
Yeah, on a fairly regular basis, and I don't think I'm unique in that. I think most chiropractors do. We're really well equipped to deal with the types of injuries that people do sustain in lots of motor vehicle accidents.
How about athletes too? Maybe some of the injuries they sustained?
Absolutely. Yeah, sports injuries, like soft tissue injuries, ankles, knees, we can work with those too. It's not just about the back. We do tend to specialize in the back, and so that's kind of what we're known for, but we branch out, and people have different areas of clinical interest that they'll work into.
I've noticed too when I go in for my chiropractic treatment that when the neck gets cracked and they pull the head, I'm like, oh, I feel so great. I feel like all stretched up and I feel 1.5 inches taller again. This is wonderful.
There you go. Take a little tension off, right?
Is that an endorphin release as well? I mean, what is that when they're cracking the neck?
Yeah, there's some biochemical changes that happen too. But yeah, we're taking stress off. I like to talk about stress a lot in the office, and it can build up, and a good adjustment can help to just release that and let you feel, like you said, a little bit taller.
Yeah.
Maybe temporarily, but taller for a while there, and just letting the body function like it's meant to function.
How important is it to have a therapeutic massage before you get treated, like with a chiropractic treatment?
Yeah,
adjusted?
I think that varies from person to person. Some people it can be quite helpful. It just gets them a lot loosened up and more ready for an adjustment. Some people like to have a massage after the adjustment. The two definitely can work well together, but it's kind of preference whether it's before or after.
Okay, now when it comes to chiropractic treatments as well, backs, like you said, that seems to be a real issue with a lot of Canadians. Do you find that sometimes people are hunched over? Are you teaching proper posture technique as well?
Absolutely. On a regular basis, I'll walk into a treatment room and somebody's sitting like this. They got their phone out in front of them. So I try to take a moment to teach about posture, and I incorporate that into my care plans as well. But yeah, almost everything we do tends to bring us this direction. So the more we can counteract that and try and work against those effects of gravity, the better it's going to be for us in the long run.
Do you teach exercises as well to maybe help people with their posture and strengthen certain muscle groups?
Absolutely. Yeah, I think that's an important part of care, because once we got things moving and aligned the way they should be, posture is how we support that. And if we can maintain a healthy posture, we can really make the most out of the care. So absolutely.
How do you deal with toddlers, and maybe young children as well? I mean, you have to be very careful. Their bones are smaller.
Yeah.
You want to make sure you don't break anything.
Absolutely. Yeah, if you've ever seen an infant adjustment or a toddler or a small person, it is a little bit different. There's a lot less force necessary to make the adjustments. they deal with some of the same issues, but the treatment that we use is just a little bit different, like you said, more gentle at times, and they tend to respond quite quickly too, which is great.
Does it help with colicky babies as well if they're misaligned?
Absolutely, yeah.
You know?
I've had a lot of really happy moms after they bring in a colicky baby, and then the mom can actually get a good night's sleep as well. So yeah, there's been some studies done showing that it has positive effects for colicky babies.
Now, what about the manipulator? Is that used on children as well?
Like the activator?
Or the activator,
yeah.
pardon me, yeah.
Well, there's different adjusting instruments, and they go by different names.
Right.
And yeah, you can employ that with a baby as well.
Okay. What about working with seniors? I know my mother's quite nervous. She's in her 70s now.
Okay.
And she's like, I've got brittle bone disease, and I'm not going to go see a chiropractor. They're going to not just crack me up, but break me up, perhaps, right?
Yeah.
So how do you put seniors' fears at ease, and how do you adjust seniors?
Well, I just try to let people know that I'm going to try and do the best thing I can for each individual patient. So if I know someone is a little bit on in years and maybe their bones are brittle, of course we're going to be more careful. We may do things a little bit differently. I employ, and lots of people do, different soft tissue techniques as well that can really help with the adjustment or the mobilizations that we're performing.
Some stories that we've covered on Bridge City News actually showed case studies where people were concerned about chiropractic care being dangerous. And you know, people have been paralyzed. They go see a chiropractor, more so in the States than in Canada here, and they left being paralyzed. So how do you set people's fears at ease?
Yeah. Once again, just case by case, trying to talk to people, explain what their needs are.
Educate them?
Educate them, yeah. There's really a good body of research that shows that chiropractic care is a very safe form of care. We don't use drugs. There's no surgery. Inherent, because of the natural nature of the care, it's just inherently safe. So I try to just back it up with the evidence and teach people what we're doing and what the benefits can be for them.
So how about somebody that's coming to see you for the very first time, Aaron? They say, I've never been to a chiropractor in my life. You know,
Yeah.
How do you introduce them to chiropractic care from the onset?
Yeah, I think education is huge. Just kind of talking them through things, talking about their concerns, making sure that it's patient-centered care is very important so that they feel like we're there to address their concerns. And if we can do that, then we can kind of break down those fear barriers and help them be able to experience the benefits of the care.
Do you do any tests as well? Watch the way people walk to see if they favor their left or their right leg, or they're putting some of the pressure, you know?
Yeah, absolutely. There's a number of different orthopedic tests that we'll employ. Every patient is going to get a comprehensive history, so we're going to learn about some of the challenges that they're facing, and then orthopedic and physical exam, so we can really zero in on the cause of the problem and try and just do what's necessary to get them the relief they're looking for.
Alberta Health Services used to pay for a good portion of chiropractic treatments, but they no longer fund this. Do most healthcare plans actually cover a lot of the treatments today?
Actually, yeah. A lot of the extended health coverage plans have a good portion of care for chiropractic services.
Let's go back to talking a little bit about infants and the care, the tender care that you have to put into adjusting a toddler, like a baby. And you can't really crack their necks. I mean, so how do you actually adjust a baby? How does that look?
Yeah, it's different than you'd see with an adult's adjustment. Lots of times it's more of just a slow, sustained pressure to an area, as opposed to what you might be referring to. I don't like to use the word crack, but with the adjustment that you'll see on an adult. So kids are different, and so it's, like I said, slow, sustained pressure, some mobilizations, as opposed to a more forceful manipulation or adjustment.
What actually happens within the joint itself? There's that popping sound. Is that air that's being released? Like, what's going on there?
Okay. Do you have a minute?
Sure, yeah, we do.
Okay, good.
Go ahead.
Good. So with the adjustment, people talk about air. Well, there's no air being actually released from a joint. It's a closed system, but each joint in the body has a capsule. It's a ligament. It's called a capsule that surrounds the joint. Within the joint, that's where the synovial fluid is, or the fluid that's in the joint. Okay. So when you make the adjustment at times, what we're doing is, in effect, we're stretching that capsule. So it's increasing the volume inside that area, or increasing the volume and decreasing the pressure in there. Okay. So the gases that are in solution, when that pressure decreases and the volume increases, those gases temporarily come out of solution, but it's within the joint space. So then over time, they'll slowly dissolve back into solution. A good analogy is kind of if you took a can of soda there's gases dissolved in solution in there as well. It's, you know, when you crack the can open, you hear the pop.
Yeah.
If you were to stretch the can without opening the space, that's kind of more analogous to what the joint is doing. Did I bore you there?
That's wonderful. No, it's wonderful.
Yeah.
And if there's going to be a test afterwards, I took some notes here, so I think we should be okay.
Perfect.
My kids, and they're 20s now, not really kids anymore, but my son likes to adjust his own neck. He does that. And I see a lot of young people do that, doctor. They take the crack, and is that dangerous? Could they paralyze themselves by doing this? But he feels so much better afterwards, you know?
Yeah, I wouldn't go so far as to say that. I tell my patients all the time, if you're just moving through ranges of motion.
No. He's taking both hands and.
Yeah, that makes me nervous. Okay?
That makes me nervous as a father, right?
Absolutely.
He says, Dad, don't worry, I'm fine.
It's typically a sign that there's probably something wrong there. Probably something that if you were to get it addressed properly, he wouldn't always feel the need to do that. Because people that tend to want to crack their own necks or backs all the time, it's usually they do it and a few minutes later they want to do it again. There's an underlying area there that might not be getting the movement that it needs. And so that's where a professional could be of assistance to you and hopefully help you to stop feeling the need to do that all the time.
Now, my daughter also likes to get her back cracked. Okay. So, you know, I've encouraged my children to go see a professional chiropractor. They're like, no, we don't have the money for this right now. So my son will do a big bear hug, and pull her up and crack her back that way. Right? Yeah. And it works.
It does,
I hear that snap, crackle, and pop.
Yeah.
But again, he's probably not getting all of the areas that she needs adjusted, right?
Tell her she's worth it, and she should invest in her health and go see a professional. Okay?
But do you hear that? Do you hear that quite often, young people doing that?
All the time. People talk, and people always ask that. Is it wrong? Am I going to hurt myself?
Yeah, what are some of the dangers associated with that? Well,
I mean, you could take it too far and, you know, sprain a ligament or strain the muscles. It could be perpetuating an underlying problem where you're going to start to get hypermobile or more motion than you need to in some areas. And there's an underlying area of restriction that's not being addressed. So I would always say, go see a chiropractor.
So how important is regular maintenance then? We go see a chiropractor, maybe for the very first time you go see him or her, you know, 5 or 6 times, and then the next week maybe only 4 times, and then the week after that. Is it like every week we should go, every month?
That's really an individual question. And it really depends on what you want to get out of the care. Okay, so yeah, initially, if I had someone who had an acute back injury, say a week ago, they're otherwise very healthy, you know, they can oftentimes get a lot of relief with one adjustment. Okay? And if relief is all they're looking for there, they could be on their way. If they wanted to go further and to see maybe why that happened, and we wanted to reinforce some positive patterns in the body, then we might follow up with some maintenance care. If you had someone who's been experiencing back pain for 30 years and they come in, it's going to be a lot more involved process to try and make some of those changes. I'm a proponent of maintenance care. I feel like it's good to just function the way that you want to, right? And keep things moving properly. So, I mean, on average, I could throw out maybe once a month would be good for a lot of people. It's not going to be right for everyone, but if you're looking for generalities there, I could throw that out.
I've heard that adjustments also help people with sinus conditions, with headaches, with migraines. Okay. Let's talk a bit more about that.
Sure. Anecdotally, I would say I see that too. Lots of people seek out care for those specific reasons. Headaches, you know, how many people suffer with headaches? And there can be sinus issues and things happening there. So I see a lot of people that suffer with the headaches, and we can lots of times get them relief in a natural way, so they're not relying on other things to try and relieve the pain.
This may seem like a bit of a funny question to you, Dr. Bridge, but how about animals? Okay. Somebody brings in a dog or a cat, it's not sleeping well. And have you ever adjusted an animal, a pet, and helped them out? Maybe they're a little misaligned?
Well, actually, in Alberta, you have to have a different designation for that.
Right.
Through the veterinarian. Right. I'm not sure, but there's a designation.
But they actually adjust pets?
Training. Yeah. Wow. Horse chiropractic is quite big. People with their race horses and things, they have animal chiropractors. Some veterinarians take additional courses to do that. Some chiropractors take the veterinarian courses so that they can work with the animals too.
How much extra training and schooling do you have to go through as well? You know, it's like a mechanic. When I talk to my mechanic, he always has to go back to school because cars are changing.
Yeah.
You know, the technology changes.
Yeah.
Is it something very similar with chiropractic care as well?
Yeah.
As your industry changes?
Yeah, there's things that we have to stay up to date on, and through our governing body, the Alberta College and Association of Chiropractors.
That's a mouthful.
It is, yeah. That's why I fumbled with it a bit there, but yeah, we do have continuing education hours that we complete each year in order to keep our license in the province.
Now let me ask you something. You're a chiropractor.
I am.
How often do you get adjusted, and who adjusts you?
Okay. I have several colleagues that I go to.
Okay.
My dad's a chiropractor.
Oh.
So he adjusted me 2 days ago. I really try to shoot for once a week. Okay. Sometimes it's a little bit less than that, but that's my ideal, is once a week. That's where I feel good maintenance-wise.
So maintenance-wise too, if you're adjusted regularly, does that help with their sleeping patterns, getting a better night's rest?
You know, I have a lot of patients that come in for, you know, back pain, neck pain, whatever they might be struggling with. And after a few adjustments, it's almost uncanny the number of people that'll say, oh, I slept so much better after that adjustment. So when the body's dealing with that tension, and we just can kind of help it release and let it relax, it's not surprising that people do sleep better.
Dr. Aaron Bridge Chiropractic here in Lethbridge, thanks a lot for joining me in studio today.
It's been a pleasure. Thanks, Hal.
On behalf of all of us here at BCN, I'm Hal Roberts. God bless and have a great night.